Hello. Today we're going to be looking at a condition known as anaphylaxis, sometimes referred to as anaphylactic shock. We're going to look at causes, recognising symptoms and treatment. So causes then. Well, there are many causes, some of which we don't know, but typically they're things like prescription medication, nut allergies, latex allergies, bites and stings from insects. Okay, so let's think then about what happens during an anaphylactic reaction. Well, we've got the things that happen to the airway, to the breathing and to circulation. So the airway, in the airway, capillaries can dilate and start to leak fluid. This can cause a blockage or a partial blockage of the airway. In breathing, we also get problems with the airway that are quite similar to asthma. And with circulation, we can find that the capillaries expand by 3 times and therefore make the bleed or make fluid loss around the throat even worse and around other parts of the bodies. Sometimes there's also a rash, but not always. So let's think about treatment options then. Okay, well, the first thing to do is to get on the phone to the ambulance service, so by dialing 999, and they'll talk you through the process and give you support. But you need to bear in mind that the casualty could by now be feeling quite dizzy, so you'd either sit them down, preferably you'd lay them down and raise the legs. Then if they've got an auto-injector, and these are 2 brands that are prescribed by the NHS at the moment, you can get them to auto-inject, to inject adrenaline, which will help counteract the problems caused by the anaphylaxis or the anaphylactic shock, hopefully. If they can't do it, you can put hand over hand and help them to do it. You don't have to draw needles up or anything like that, simply press it, usually against the thigh. It's not recommended in the upper arms, and be prepared to give a second dose 5 or 10 minutes later if they have a secondary reaction. The person should always go to hospital because they could have a secondary reaction. Be prepared to do CPR, they may stop breathing. Remember to clean up the scene afterwards, so dispose of anything like this. You could take these to the local medical centre or pharmacist when they're used. There is likely to be a needle sticking out, certainly in this one, although in this one the needle remains covered. If you've got any blooded items or anything with body fluids on, that needs to be disposed of carefully and the area made safe. Thank you for listening.